All right, thank you, Diane. As Diane so graciously introduced, my name is Pam Esher. I am the stroke coordinator, one of the stroke coordinators at Capitol Health. I reside at the Hopewell campus, and we are pleased to be able to present a program during May, which is Stroke Awareness Month. And we're going to present stroke. It's preventable, treatable, and beatable.
I don't know.
All right, and here's a lovely picture that shows that May is American Stroke Month, and we like to use the heart to show that we have to love our heart to help our brain. All right, so what we're going to talk about today is definition of stroke, the epidemiology in the United States, symptoms of stroke, risk factors, and treatment of stroke. So we're going to start out with talking about what is stroke. Stroke is a sudden interruption of the blood supply to the brain. So a stroke occurs in the brain and is a brain attack. This occurs in two ways. One, when a blood clot blocks the blood flow in a vessel or artery, or two, when a blood vessel breaks, interrupting blood flow to an area of the brain. When either of these two things occur, brain cells begin to die and brain damage starts to occur. A transient ischemic attack, or TIA, is a warning sign, or what many people in the community call a mini stroke. This results in no lasting damage to the brain, but recognizing and treating a TIA immediately can help reduce your risk of having a major stroke. About 795,000 strokes occur every year in the United States. As I said before, there are two types of stroke. Ischemic strokes occur when an obstruction within a blood vessel blocks the supply of blood to an area of the brain. This type of stroke accounts for approximately 80% of all cases. Hemorrhagic strokes occur when a weakened blood vessel or aneurysm ruptures and blood spills into the brain tissue around the brain. And that happens approximately about 13% of the time. So you can see here under the hemorrhagic stroke side on your slide that you have a blood vessel that bursts. And then if you look down where it says brain aneurysm, this is a depiction of a brain aneurysm, and it is kind of like an outpouching or a blister on your arterial wall, and it pops, and that's what causes the bleeding. Then you have your brain AVM, or arterial venous malformation, and this is where you have a mishmash of vessels and something bursts. And here's just some statistics. And again, about 795,000 Americans each year suffer a new or recurrent stroke. So about every 40 seconds, a stroke occurs. Stroke kills more than 137,000 people a year. That's about 1 in every 18 deaths. On an average, someone dies of stroke approximately every 4 minutes. Stroke is the 5th leading cause of death and the leading cause of disability. So when we talk about stroke, we need to talk about stroke symptoms. How do you identify if someone potentially is having a stroke, or if you think you're having a stroke? So we have symptoms. These symptoms occur suddenly. It's not something that happens over a couple days, a week. It's things that happen suddenly. So you have sudden numbness or weakness to the face, arm, or leg, and especially on one side of the body. You have sudden confusion, trouble speaking or understanding what people are saying to you. Sudden trouble seeing out of one or both eyes. Sudden trouble walking, dizziness, loss of balance, feeling wobbly, feeling like you can't walk straight, almost feeling like you may be walking drunk, except you haven't had any alcohol, or a sudden severe headache of no known cause. What's important to know is that stroke is preventable. There are risk factors for stroke, and they fall into two categories. They fall into risk factors that can be controlled through lifestyle changes or medication, and those that cannot be controlled, such as race, age, and sex. It's important to know that just because you have uncontrollable risk factors does not mean you're going to go and have a stroke. Most strokes are preventable. With the proper attention to your controllable risk factors, the impact of the uncontrollable factors can be greatly reduced. The uncontrollable risk factors that we mentioned is age. The chances of having a stroke do increase with age, and about 2/3 of all stroke patients are over the age of 65. The male sex has a slightly higher risk of stroke than females. African Americans have a higher risk than some other groups. Hispanics have an also increased risk of stroke. And Asian and Pacific Islanders are also having a rising increased risk of stroke right below Hispanics. And you do have a higher risk of stroke if you have a family history of stroke or TIA. So what can we control? What risk factors for stroke can we control? So we look at high blood pressure, heart disease, diabetes, cigarette smoking, right? With high blood pressure, you want to treat that high blood pressure. Know what your blood pressure is. If you need to lower it, you want to work on lifestyle changes such as eating a balanced diet, maintaining a healthy weight, exercising to help reduce that blood pressure. If you need medication, you can take medication to help reduce your blood pressure. You want to make sure you're taking it as your provider directs you to. With heart disease, you want to manage that heart disease, right? Like atrial fibrillation. Your doctor can treat that and may prescribe medication to help the prevention of clots forming. Diabetes, you want to control your blood sugar. That can help reduce your risk for stroke. And cigarette smoking is not, well, we all know it's not healthy at all for you now. So if you do smoke, you do want to work on quitting, and there is medical support available to help you quit. So monitoring your blood pressure, controlling your cholesterol, keeping your blood sugar down, eating a healthy diet, maintaining a healthy weight, not smoking, and talking to your doctor about aspirin or other medications are all steps you can take to reduce your risk for stroke. What's important to remember, though, is aspirin isn't appropriate for everyone, so you really want to talk to your doctor before you would start a aspirin regimen. But choosing healthy meals and snacks can help reduce your risk for stroke. Eating plenty of fruits and vegetables, eating foods low in saturated fat, low in cholesterol, high in fiber. These are all things that can help prevent high blood cholesterol. And limiting your salt or sodium intake can also help reduce that blood pressure. Being overweight or obese can increase your risk for stroke. And to find out whether, like, what is a healthy weight or range for you can be provided by your doctor, and that your doctor can calculate your body mass index or BMI. So you want to have that conversation with your doctor to see what is a healthy weight that you should be at. And being active. A sedentary lifestyle, a lifestyle low in physical activity can be a risk for stroke as well. So you want to be active. Physical activity can help you maintain a healthy weight. help lower that blood cholesterol, and lower your blood pressure. The Surgeon General does recommend that adults should engage in moderate intense activity for at least 30 minutes a day, most days of the week. So what can you do? What can you do along with these lifestyle changes to help lower your risk for stroke? You want to know your numbers, right? Have your cholesterol checked. Know what your cholesterol levels is. What are your LDLs? So your cholesterol levels should be tested at least once every 5 years. And you also want to know what your blood pressure runs, right? Monitor your blood pressure. High blood pressure doesn't have symptoms, so you want to make sure you're checking it on a regular basis. A lot of people that come into the hospital in the emergency room who have stroke symptoms, when we ask them, do you have any medical history? Do you have any medical history of high blood pressure, high cholesterol, so on and so forth? And they said, no, I don't have any medical problems. But when you take their blood pressure, it's really very high. So they've had high blood pressure, they just didn't know they had high blood pressure. And the problem is you don't know you have high blood pressure until you start having problems, and then you're running into issues, and you have to try to control it quickly. This is a stroke scorecard from the National Stroke Association, and this lists all of the stroke risk factors on the left-hand side in the blue column, and then you have a red, yellow, and green column, right? So it's high risk, medium risk, and low risk. And you can take this and evaluate where are your risk factors and what might you need to do to lower your risk for stroke. The ideal blood pressure for an individual would be less than 120/80. Non-smoking, and you can see maintaining a healthy weight, exercising 3 to 4 times a week, having that cholesterol lower than 200. BFAST is the acronym we use to help educate people on what are the signs and symptoms of stroke, because it's difficult to remember all of it. So if you remember BFAST, it will help you remember the signs and symptoms. So we already went over them, but I'm going to put them in context of this acronym. The B is for balance. That's that sudden loss of balance, dizziness, feeling wobbly, unsteady. E is for eyes. Sudden vision changes, not being able to see right out of one or both eyes. F is for face. Sudden facial drooping, numbness and tingling to the face, usually on one side. Sudden severe headache. And A is for arms, right? Sudden weakness, numbness of the arm. It can also be your leg or a combination of both arm and leg, weakness or numbness. And then S is for speech. Sudden trouble speaking, trouble getting your words out, sudden confusion, not being able to understand what people are saying, being confused of what's happening around you. And then T is for time. Time, you want to call 911. If you or a loved one shows any of these symptoms of stroke, you should call 911 immediately. And note the time the symptoms started. Don't let that person go to sleep, and don't give them any medications, food, or drink. Call 911, get them to the emergency room right away to be evaluated, because time is very critical when it comes to treating stroke. So there are challenges of identifying stroke symptoms, because we have, there are many stroke mimics, and stroke presents in many ways with varying intensity. I'm sorry, Maria, do you want to do this? I think I started talking into your area.
You're good, Pam.
You want me to keep going?
Keep going.
Okay. Maria has some bronchitis and she's having a little difficulty. Someone may present with a facial droop. All right. So if someone comes in and they have stroke-like symptoms, and this could potentially be another medical condition, we're going to go down both pathways. We're going to get down the stroke pathway. We're going to go down the other pathway until we rule that out. because we want to, identify the patient's medical problems as soon as possible and as quickly as possible. So facial droop. A facial droop could be caused by a stroke, could also caused by a medication, maybe a medication reaction. Slurred speech. That could also be, medication reaction. It could be someone is like missing some teeth. Maybe they have an abscess swollen inside their mouth. Dysphagia or aphasia, having a difficult time pronouncing your words or difficulty understanding the words. That could be potentially dementia, maybe low blood sugar. Numbness to the face, arm, and leg. That could be a pinched nerve causing that type of problem. A headache. Many people who have a headache could potentially have a migraine. People have migraines and they present with really terrible headaches. They can also, with their migraine, they could have alteration in vision, alteration in facial muscle strength, where they could have a facial droop, maybe numbness and tingling. So we go down both pathways. Weakness or paralysis. A gait disturbance. Dizziness, loss of balance. All of those could potentially be maybe a middle ear infection, vertigo, right? So there's other things it could be, but it could also be a stroke. Loss of vision, altered vision. Being incoherent, incontinent, altered mental status. Elderly individuals, if they have a urinary tract infection, that can cause them to have altered mental status, confusion. So we go down all pathways. Yes, these are all stroke-like symptoms. They could be something else, but you don't want to rule out stroke. You don't want to say, oh, this is not a stroke, and then go to bed and then find out that you had a stroke later. You want to get that treatment right away. And here are some examples of someone who is presenting with stroke-like symptoms. This is dizziness, weakness, trouble speaking, and vision changes.
You know me. You see people like me every day. But would you know when to act if I suddenly felt lightheaded and the room started spinning? If I couldn't do the simplest things, would you know something was wrong? Or if I wasn't speaking clearly, would you know this is stroke?
Signs of stroke can be sudden and easy to miss. The moment something seems off, don't hesitate, call 911. Stroke, react, don't regret.
You know me. You see people like me every day. But would you know when to act if I was unsteady on my feet? If my head suddenly ached? Or if I didn't know what was happening around me? Would you know this is stroke?
Signs of stroke can be sudden and easy to miss. The moment something seems off, don't hesitate, call 911. Stroke, react, don't regret.
You know me.
That's a good question.
You see people like me every day. But would you know when to act? If I couldn't think clearly or find the right words, what would you do if I suddenly couldn't feel my arm? I couldn't walk straight. Would you know this is stroke?
Signs of stroke can be sudden and easy to miss. The moment something seems off, don't hesitate, call 911. Stroke, react, don't regret.
All right, so Pam had said, excuse me if I start coughing. Pam had said, stroke is time sensitive. There's only so many certain things we can do if you call 911 and get to the hospital right away. So there are larger strokes that we can actually go in if you have a dislodge a clot or plaque and they block off your larger vessels, where we can go in and remove those clots. So those are your large vessel occlusions. They're a type of stroke that can actually cut off the entire supply of one side of your brain or the other. They have the highest rate of mortality, and they do have the poorest outcome, especially if you don't get to the hospital right away. So thrombolytics is one type of treatment for stroke. Alone, they may not work for your larger clots or plaque to dislodge. But if you're within 24 hours and you have that large vessel, which we can see on the imaging, we can go in and actually retrieve that clot. So calling 911, knowing the signs and symptoms, calling 911 and getting to the hospital as soon as possible is the best chance of recovery. Okay, so saving the penumbra is what our goal is as healthcare providers. So getting out, you guys understanding what are your risks for stroke, what are the signs and symptoms, and calling 911. So when you're having a stroke, you can think of it like an egg. So you have the yolk on the egg, and the yolk is that core infarct. So that's either the plaque breaks off and travels, or you have a blood clot, maybe from AFib that travels, blocks the vessel in your brain. That as that vessel is being blocked, the cells around it start to die. So think of it like an egg sitting on a frying pan. The longer it sits, the whiter the whites get. That's actually your brain dying if we're unable to reperfuse the brain. So the penumbra is what we're trying to save. The infarct is the permanently dead tissue. And that's just one way of looking at it. Okay, so we have two treatments. So if you're, it's IV thrombolytic therapy, which is a medication that we can give if you meet certain criteria. And then the other is mechanical thrombectomy, where we actually go in through the vessel and retrieve that clot that's causing the occlusion. So medical management, the IV thrombolytic, we give tenecteplase here. If you arrive within 4.5 hours of your last known normal, that's why it's always important. And when you do come into the hospital, always say, when did the symptoms start? When were you at your normal baseline? Because the medication can only be given up to 4.5 hours from that time. And there are other kind of indications. So if you're on blood thinners, you may not be eligible. The other option is the mechanical thrombectomy, where we actually, it's a stent retriever placed into the vessel. The catheter is advanced, and then you can actually retrieve and pull out that plaque or clot. And that can be done up to 24 hours for patients that are eligible. If you come in within the 4.5 hours, you can actually receive both the medication and have the mechanical thrombectomy. So this is just a little video that shows you a little bit about the mechanical thrombectomy. So you can see they put the catheter in. Travels to the brain. They put out the stent. They capture whatever is the debris that's causing the blockage. There's the stent covering the debris, and then they can actually pull that clot out and reperfuse the brain. So, like I said, and Pam has said, the big thing with stroke is knowing the signs and symptoms, not only for yourself, but your loved ones, and then not only knowing them, but calling 911. You never want to, a lot of times, unfortunately, people will wait a day or two, but when you have that sudden onset of symptoms, whether it's your face drooping or you're having difficulty with speech or weakness on your arm or leg, depending on the location of the stroke, you can have weakness on your leg, you can have weakness on your arm, or both on the one side. So if it's a right-sided stroke, you'll have symptoms on the left side and vice versa. And then our posterior strokes, that's our balance. That's when you're feeling like your gait is unsteady. You kind of feel like you're drunk when you're walking. So that's your dizziness. So knowing the signs and symptoms of stroke, calling 911, getting to the hospital as soon as you can, then we can, we're able to give you the treatments that you need. And you have a better chance of recovery.
So we do have a few questions, and I will be happy to read them to you. And if other people have questions, please feel free to put them in the chat box. Or at the end of the questions that I read, you can take your microphone off and ask the question directly. So one question is how to tell the difference between a stroke dizziness and a medication dizziness side effect.
So right away, you're not going to know. We would again go down both pathways. Is this a stroke? Is this a stroke, or is this a medication? So a medication side effect. Let's just say I'm not sure exactly, Ronald, what type of medication you're asking about, but say it's your blood pressure medication or your heart medication. And now your heart's beating maybe too slow, or maybe your blood pressure is a little low on the lower side, and it's not usually that low. So this is what's making you dizzy. When you come into the hospital, the emergency room, they're going to check your heart rate, your blood pressure, your oxygenation, and everything like that, and they're going to, ask you about what medications you're on. And then the dizziness, we're going to consider that it could be a stroke, and depending on the assessment of the provider, who is our expert in assessments, they're going to determine whether they're going to go down the stroke pathway, as well as like a medication effect as well.
And a lot of times too, with your posterior strokes, not only you have the dizziness, but you may have slight other symptoms. You might have some trouble with your speech, or you may notice that one side of your face is drooping. You may notice you have a little bit of numbness in your arm or your fingers, very slight, maybe even like you're just clearing your throat a little bit, like you feel like you're just having trouble with your swallow. So a lot of times with the posterior strokes that have the dizziness, there's those slight other symptoms that go along with it. But if you're unsure, you should always come into the hospital.
The next question is, in terms of smoking, this individual didn't smoke, but used to chew nicotine gum and use a patch. Is nicotine a cause for stroke?
Now, smoking itself actually weakens the blood vessels that causes the stroke. The research really hasn't shown that the nicotine caused by like the gum causes stroke or hypertension.
If someone has had none of these, I'm sorry, you have none of these symptoms occasionally months before a stroke actually happens, there's no way to know that a stroke is coming?
Unfortunately, stroke is sudden. So a lot of times people will get stroke mimics where they may have minor stroke symptoms, whether it's the speech or the vision issues or weakness on one side or the other, that may only last 2 to 15 minutes. And they don't think anything of it. That is their warning sign. But unfortunately, with stroke, it can happen to anybody at any age, from inter-utero to 100 and some years old. And there is no, it's sudden. It's that sudden onset of symptoms.
Can you share, how does blood sugar increase the risk of a stroke for diabetics? What happens with the blood sugar?
So with an increased, so you're diabetic, so your blood sugar is going to be elevated. So if you are diabetic and your blood sugar is elevated on a longer term basis, you're going to run risk of it lends to cardiovascular disease. It affects your blood viscosity. It's going to can cause problems that way. So with your with diabetes, the risk of cardiovascular disease, because of the way the increased blood sugar affects the blood and the arteries, that's how it's going to increase your risk for stroke.
Okay. Is there any test to see if you have blockages in the brain before you have a stroke?
So we do have, there are tests that we do that are through like screening. One is You can have an ultrasound of your carotid arteries. You can have a study done, and they'll be able to tell whether or not you have plaque buildup or carotid stenosis in your arteries. The more stenosis someone has, the higher risk of having a TIA, which is that warning sign, or going on to have an actual stroke. And there's interventions that can, like surgery, getting stents, having a carotid endarterectomy. Someone can have that, if it's severe enough to prevent a future stroke. So yes, you can have, depending on, whether you have different symptoms or TIAs, you can have an MRI. And an MRI is going to show whether you have, stenosis in the arteries, gut feeding up to the brain.
When you call 911, should you tell them, I think it could be a stroke, even if it seems to be just one of those symptoms of dizziness or that seem like a lot of elderly people get, loss of balance or incontinence?
If it's a stroke symptom and you feel that it's a stroke, don't be afraid to say, "Hi, this is so and so. I think I'm having a stroke." They'll ask you what your symptoms are. You'll tell them. They will come out. They'll assess you. And what's important to know, that say you think you're having stroke symptoms and you think you're having a stroke, and you go to the hospital, go to the emergency room, and maybe it's not a stroke. Maybe it is a UTI. Your elderly mother, has a UTI, but she had this sudden confusion. We've had elderly people come in who they think, oh, mom has a UTI, but they actually did have a stroke. So don't be afraid to call 911. If you get to the emergency room and they do a workup and it ends up not being a stroke, that's okay, because it's better to err on the side of caution than to ignore it. Because if you don't get treatment right away and get any intervention that's potentially you're a candidate for, you would miss out on that ability to potentially, decrease a disability.
And can you, how do you tell if somebody had a stroke previously? And along with that question, any chance to having a second stroke, and what is the percentage of having a second stroke? So how do you identify if someone had a stroke, and then what are the chances of them getting a second stroke?
A lot of times patients come in and they don't know that they've had a stroke, and we'll see when they get the CAT scan of the head or the MRI, it'll actually show that they had a stroke previously or multiple strokes previously. Anybody that has a stroke or a TIA is at a higher risk of having additional strokes. So it's just managing your risk factors. So if you have hypertension or diabetes, just making sure that you're keeping your levels within range to help reduce your risk of having another stroke.
Are there any other questions that anyone would like answered? They can take their phones off or your computers off mute, or you can send it in the chat. One other thing I'd like to ask is, where does one get that stroke scorecard?
You can get it online through, I think it's the National Stroke Association. If you type in a Google search, stroke scorecard, there are all different types of stroke scorecards. I like that one because it's kind of colored and you can check off, your risk factors and where you might be. You can get it on the National Stroke Association. And Diane, if anyone's interested and they want to get that, I can certainly send you something that would be you could just email out to them. That's not a problem.
Okay, terrific.